Good day everyone. Today we will be presenting our pharmacology topic on Lama versus Laba, which are long-acting bronchodilator used in the management of chronic respiratory disease such as asthma and COPD. Firstly, what is Laba? Laba stands for long-acting beta agonist. It is a type of a long-acting bronchodilator that works by relaxing the smooth muscle around the airways. It is also allowing the patient to breathe more easily. Laba medication are always administered via inhalers and are commonly used by patients with chronic lung disease such as asthma and chronic obstructive pulmonary disease, or known as COPD. This is the example of long-acting beta agonist inhaler. First, we got indacetrol inhaler, and the second one is the formoterol inhaler. Secondly, what is Lama? Lama is known as long-acting muscarinic antagonist. It is a long-acting bronchodilator that works by blocking muscarinic receptor to prevent airway constriction. It is mainly used in the management of COPD. In asthma, Lama is not used as a monotherapy but may be added to the inhaled corticosteroid in selected patients. And this is an example of Lama inhaler. First, we got tiotropium respimat, and the second is umeclidinium incrus ellipta. In addition, there is also Laba and Lama combo inhaler. First, we got Anoro ellipta, and the second is tiotrorespimat, and the last one is duacleproside. Laba medication are available in inhalation dosage form and are administered by the pulmonary route using inhalers. Common Laba device include metered dose inhaler and dry powder inhalers, which deliver the medication direct into the lung for rapid and effective bronchodilation. Lama medication are also administered via inhalation through the pulmonary route. They are commonly delivered using dry powder inhalers or soft mist inhalers, allowing long-acting bronchodilation, especially in patients with COPD. Correct inhaler technique is essential to ensure the medication reaches the lung effectively. Poor technique can reduce the drug delivery and treatment effectiveness. Pharmacy personnel play an important role in educating patients on proper inhaler use.
This is a case scenario involving a male who is heavy smoker of over 25 years. His patient profile includes persistent shortness of breath, frequent coughing, and a bad chest cough, putting him at risk of asthma and COPD. The recommended first action is to use Labas, long-acting beta-2 agonists. These relax the muscles around the airways to make breathing easier. This should be combined with better daily movement to help with hunger during activity. For a long-term action plan, the focus shifts to using Lamas, long-acting muscarinic antagonists. Lamas are described as the best defense against major lung attacks, helping patients stay out of the hospital and preventing the need for emergency room visits. It is important to be aware of potential side effects. Labas may cause a faster heart rate, while the common effect of Lamas is dry mouth.
Based on the case scenario, which drug is better, either Lama or Laba? The answer is Lama is the most suitable option. Initial therapy with Laba combined with inhaled corticosteroid should be avoided due to the increase of risk of pneumonia, especially in COPD patients. Lama is effective in managing COPD symptoms. It is more cost efficient and helps reduce the risk of expensive emergency room visits.
This slide shows the drug profile comparison between Laba and Lama. They have a mechanism of action, side effect, indication, and also dosage. First, let's move to the mechanism of action. Laba, or long-acting beta-2 agonist, work by stimulating beta-2 adrenergic receptor in the airway smooth muscle. This causes bronchodilation, improve mucociliary clearance, and reduce the release of inflammatory mediator from mast cell. Lama, or long-acting muscarinic antagonist, work by blocking muscarinic M3 receptor in the airway. This leads to the bronchodilation, reduce mucus secretion, and improve airflow. In summary, both Laba and Lama help to open the airway, but they act through the different receptor and mechanism. Next slide will be the side effect using Lama and Laba. The common side effect will be thermal, headache, constipation, urinary retention, dry mouth and throat, heart palpitation, cough, and nasopharyngitis. And for the serious side effect will be the high dose lead to the hypokalemia and unexpected airway tightening. Next slide will be indication for Laba. They have asthma, COPD maintenance therapy, not for acute asthma attack, prevention of exercise-induced bronchoconstriction. And then for Lama, they have a reduction of COPD exacerbation and symptom, and add-on therapy in moderated to severe asthma.
Two important classes of inhaled medication used primarily for managing COPD disease. For the Labas listed on the left side, we have several options. Formoterol is typically taken as 2 inhalations twice daily. Next, indaceterol is once daily puff. Oladaterol requires 2 puffs once daily. And for salmeterol, the dosage varies based on the condition, 1 puff twice daily for asthma in adults versus 2 puffs twice daily for COPD. On the right side for the Lamas, dosage tends to be the simpler, often once daily. Tiotropium bromide involves 2 puffs once daily, while both umecilidinum and its combination with Laba are administered as a single puff once per day.
Generally, long-acting beta-2 agonists such as indacaterol and olodaterol have a faster onset of action, taking effect within 5 minutes. But there is also the exception, such as salmeterol, which requires roughly 20 to 30 minutes to begin taking effect. Meanwhile, long-acting muscarinic antagonists have a generally slower onset of action, with an average of 10 to 20 minutes, with tiotropium in particular having a delayed onset of 30 to 60 minutes. When discussing the availability of these drugs, it must be noted that both classes of drugs are not available over the counter, as one requires a prescription from a certified pharmacist or healthcare professional to obtain them. Pricing is also dependent on the respective hospitals and pharmacies, though it should be noted that LABAs are generally cheaper than LAMAs. As for usage in children, LABAs typically see use in the treatment of moderate to severe persistent asthma in children at the age of 4 years and above. Meanwhile, LAMAs are generally not recommended to children under the age of 6 years and are only given under specific circumstances. In addition, usage of either class of drugs for geriatric use requires careful monitoring, as the elderly are more exposed to potential side effects, be it either cardiovascular side effects for LABAs or anticholinergic side effects for LAMAs. Now, we will talk about the suitability of distributing these drugs to certain groups of people. Both classes of drugs have been given a pregnancy rating of C by the United States Food and Drug Administration, as there are insufficient data on human and animal studies, but the drugs have been deemed acceptable to pregnant women despite the risk. In my time researching this topic, I have come to realize the importance of collaborating with patients and making shared decisions to determine the best healthcare approach for them. We must remember that every patient has their own unique experiences with a given illness and their own goals and preferences regarding the treatment. Thus, every treatment should be adapted to suit the patient's needs and circumstances to improve the treatment adherence and future health outcomes.
The value that I learned in this case is I learned that choosing between Laba and Lama drug is just not about effectiveness, but is about selecting the most suitable option for the individual patient. Patient factors such as age, comorbidity, safety profile, and lifestyle must be always to be considered to ensure optimal treatment outcome.
Here is the tips about Laba and Lama. Laba and Lama inhaler combines two acting medicines to keep your airways open all day. Use it every day, even when you feel fine. It helps you breathe easier, reduces flare-ups, and improve your daily activities. So do not stop using it unless your doctor says so. Always keep your rescue inhaler handy for sudden symptoms. Thank you.
This pharmacology presentation helped us understand the importance of patient-centered reasoning in medication selection. Choosing between Laba and Lama is not only the based on drug efficacy, but also on the patient condition, safe, cost, and long-term outcomes. This topic also emphasizes empathy and ethical practice as healthcare professionals must consider the patient quality of life and avoid treatment that may cause unnecessary harm. As future pharmacy personnel, we have the ethical responsibility to ensure the medication are chosen safely, fair, and in the best interest of patient. That's all from us. Thanks for watching. Scan the QR for the reference.